Cancer Treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery, New York, super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back.
Thanks for tuning in to the radio.
We're back. Hi, John. How are you?
All right, doctor.
So there's new news about hair loss from chemotherapy. And obviously a lot of people find hair loss the number one issue. They don't want to take chemo because they don't want to lose their hair.
Sure, that's the first thought.
And I'm a chemotherapist. I spent 6 years at Harvard training and giving chemotherapy. So I'm used to it, used to talking about it, and a lot of patients, it's the number one concern. So the new study going on actually to try to cool the scalp. So like if you can imagine getting a swimming hat on that's filled with coolant, and try to make it so cool that the blood vessels contract.
Okay.
And if you make the blood vessels contract, there's less chemo going to the hair. If there's less chemo going to the hair, there should be less hair loss.
Right.
So there's a new protocol that's going on. It's a multi-center study involving 110 patients at a variety of centers to try to cool the scalp to avoid hair loss. And studies have shown that if you cool the scalp, you do get less hair loss, and actually you do not get cancer that spreads to the scalp. The big concern was, okay, you get less chemo to the scalp, but also you can get cancer that can spread. So It seems like it's safe to do. And so there's an ongoing study using temperature. We use temperature to try to cure cancer. So we actually do the opposite. We have one of the few machines in the area in New York to actually heat cancers. It's called hyperthermia.
Okay.
And hyperthermia has been known for thousands of years, since the time of Cleopatra. In those days, if someone had a cancer, often a very hot, like molten gold or molten metal would be put on the cancer, if you can imagine that.
Yeah.
So it must have been pretty painful.
I would assume so.
But it would be associated with the regression of the cancer. So for thousands of years, doctors have known that if you heat a cancer, you're going to have better control of the cancer. Mm-hmm. Right now, in America, heating has to be done with either concurrent, which means simultaneous chemo or radiation. But we seem to get better results. We treat a lot of cancers of the skin or superficial, things that you can feel, maybe of the head and neck area, the breast area. Sometimes cancers will come back even after mastectomies, and so we heat the skin. Usually takes about 1 hour. The machine is made by the only company that's FDA approved in the United States to deliver hyperthermia. So temperature is used. You think about, we talked about vegetables and fruits before, but a lot of chemotherapies, a lot of agents, a lot of health medicines are actually from bark of trees and leaves, like digitalis for the heart is from leaf, foxglove tea. Adriamycin's from a fungus in the Adriatic Sea. So from nature we get a lot of things, and heating and cooling is kind of from nature to try to take advantage of natural elements to help people with cancer get better results than they would otherwise. We have Dr. Eisen on the phone. Dr. Eisen, good morning.
Good morning, Dr. Lederman. How are you?
Dr. Eisen is a highly trained Spanish-speaking oncologist. There's not many in his field. He was born in Argentina. He came to the United States after he went to medical school there, trained at Columbia in radiation oncology, and is a bilingual radiation oncologist taking care of cancer patients in our center in Radiosurgery, New York. So tell us, what's so special about being a Spanish-speaking doctor in America?
Well, I think that it's incredible. It's a big plus, particularly right now in New York City, and all the area of the New York State and around, because evidently the Spanish community is really, really growing, and they are looking for options, and they do see the difference when they can actually go over cases in their own language. Also, I do see patients coming from Latin America, other countries, and Europe, Spain. By the way, I just want to tell you that talking about liver metastases that I mentioned to you last week on the phone, I just came across with a paper from Europe that the conclusion, not only that radiosurgery to the liver metastases, it's exactly what we are doing, 90% of control, even 95%, but now at the end of the article, they were saying that probably this is going to actually change the way that people are looking at liver metastases in the past, trying to do maybe surgery or chemotherapy, because they find out that using radiosurgery, actually the side effects were extremely low, the control was more than 90%, and follow patients with PET scans, they find out that actually that's what makes the difference.
So we're just at the end of the time. I don't want to cut you off, but can you give us your phone number, how patients can find you?
They can call me for the at 917-836-8105, and in Spanish is 917-836-8105. Again, 917-836-8105.
All right. Thank you for taking care of these patients, and I know that you provide, and the staff provides great bilingual care for these patients. And your office hours, when can people call you?
They can call me actually 24/7, because that's the way that I work.
Okay.
They can call me on this number. I'm available, and we will set up appointments and everything. So, buenos dias.
Okay, gracias, Dr. Eisen. Thank you.
Okay, bye-bye.
Bye-bye. All right. For those who have questions or want the booklet and DVD, just call us at 212-CHOICES during the week, 212-CHOICES, and we'll give you information about whatever particular issues that you have, private information. Angelina Jolie had this bilateral mastectomy. She had this BRCA1 gene, which ran in the family. She had a mother who died of breast cancer, when she was about 55. She calculated that her risk of having bilateral breast cancer was about 85%, and so she did mastectomies with reconstruction immediately. She did not do removal of the ovaries, which has about a 50% chance of cancer. Removing the ovaries has a lot more implications because she loses all the hormones and would go into menopause. I think she's 37 years old.
Yeah, sure.
So she brought up a lot of interest, and a lot of women talk about bilateral mastectomies, but actually, unless you have the BRCA gene, you don't win very much by removing the healthy breast. Because if you've got just random breast cancer, the chance of getting breast cancer on the other side is about 1%.
Okay.
So women don't really need to get that other breast removed. It's something of choice, but there's no real medical reason. Thank you for the time, John, and thank you, listeners.
Thank you, Doctor.
We're going to be on WOR tomorrow at 6 to 7 a.m. and 9 to 10 p.m. We have a special guest tomorrow night. If you have questions during the week or you want the booklet and DVD, call us at 212-CHOICES, 212-CHOICES, which is 212-246-4232. Again, thank you very much, and we wish you good health, and God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.